So I'm just going to be sharing some of the data around asthma in Rhode Island, what we know, and both our data in general, and then the main topic here is Medicaid data. And I'll explain why we have these new maps that are up. So these are just very recently done maps. So in terms of the main points around asthma, asthma around the country is the most common chronic condition in children. Nationally, it's 8.4% of children who have asthma. But in Rhode Island, it's 10.9%. So we are in the top 10 in terms of states. We're the 9th highest prevalence, so that's just in terms of who has asthma. Black children and Latino children are more likely to visit the emergency room and be hospitalized for asthma. Based on just residential segregation and where people are living, we know that those emergency department visits are very much concentrated in a few areas in the state. So the top 5 cities in the state in terms of kids with asthma who are going to the emergency room for their asthma, it's Providence, #1, Central Falls, Woonsocket, Central Falls, Newport, Woonsocket, and Pawtucket. And then, so this is coming from the hospital discharge data set. So every year the Department of Health gets all of the data from the hospitals around emergency department visits. And look at it for a number of, all the different health conditions. And so one of the core purposes of what the health department does is to track different health issues in the community. And so we look at that for asthma, and that's where this data comes from. We can also tell which insurance payer is related to these ones. And so when we looked at the asthma emergency department visits in the state, we found a really stark disparity here with Medicaid covering over 70% of the emergency department visits. Asthma is very much an issue within Medicaid. It's very much, which is, just shows in terms of low-income families and a variety of issues that are impacting low-income families in the state. So we know that Medicaid is something we need to be focusing on. Here are some of the other disparities, differences and inequities that we see in asthma. So we definitely see, the economic disparities in terms of income, family income, racial and ethnic disparities. So on the left here are the emergency department rates, and on the right are the hospitalization rates. The difference between the two, just to clarify, emergency department is anytime you go to the emergency room to get checked in. If you get checked and released that same day, that's an emergency department visit. If you get checked in and get a bed and stay overnight, that's an inpatient hospitalization, which can be one night or more nights. It counts as one inpatient hospitalization. So just comparing black to white, for example, it's 21.6 compared to 6.3, so almost 3 times higher rate for black children compared to white children for asthma ED visits. For that age range, which is 0 to 4, similar dynamics for 5 to 7, and similar for hospitalization. When we compare it around the state, here are the disparities that we see here. The state average for Rhode Island is 7.1 emergency department visits per 1,000 children. But if you compare it to the 4 core cities compared to the rest of the state, it's 12.2 compared to 4.5. So again, approximately 3 times higher in terms of how much, not just who has asthma, but how severe that asthma is, so who's going to the emergency room for it. So like I said before, Medicaid, we identify Medicaid as being kind of a population we need to pay even more attention to, and so the rest of the maps I'll be showing you come from a new set of data that we got in collaborating very closely with Medicaid. So we were able to have access and analyze the entire pediatric Medicaid claims database, which basically means anytime a child who's covered by Medicaid has any type of cost, whether that's a doctor's visit, an ER visit, a hospitalization, that'll show up in this database, and we can tie it to an address, and so we can look at where people are living and make some comparisons around that. So these are just some of the details around how we define that. I'm going to skip over that, but it's there if you want to know more about kind of the data set that we are using for that. So I'm going to go through a few different sets of maps and try to explain the difference between what we're looking at here. The first one is any asthma claim. So this is looking at all of the different insurance claims for asthma across the state. And if any of them are tagged with a diagnosis code for asthma, it's an asthma-related claim. So this is our general sense of kind of who has asthma, just generally any asthma claim. It's not capturing everybody with asthma. If someone who has asthma doesn't go to the doctor for an asthma visit, doesn't have a kind of a medical thing directly connected to their asthma, it wouldn't show up in here. So we're missing some of the what we would call well-controlled asthma who don't have any connection with it in that way. They still have asthma, it's just not showing up here. So these are underestimates in terms of the total. And again, we're just looking at Medicaid. So when you look at the map, obviously we know there's demographic differences between kind of income and race in different parts of the state. We know there's different groups of people who live in different areas in the state for a variety of reasons. But when we're looking at these maps, these are all Medicaid. So it's still people share kind of a common set of socioeconomic status, regardless of where they live in the state, if they're eligible for Medicaid. So Coventry or West Warwick, East Greenwich, for example, East Greenwich we know of as a relatively well-to-do state, part of the state, but kids who are on Medicaid, they are still going to have some similarities with kids on Medicaid in other parts of the state. So we look at here by city and town, and we divided it into quintiles, so basically just kind of lining it up from lowest to highest rates, and dividing it into 5 sections. And so these are all color-coded. Blue is the lowest quintile, followed by green. Yellow is a middle.
Maybe somebody wants a middle.
Thank you. So yellow is the middle, so that'd be kind of the average. Orange is the 4th quintile, and red are what we are kind of calling the hotspot areas. And so this is the same information on this side, but on this one we are just breaking it into census tracts, which allow us to get a little bit more detailed around where this is. So for example, we notice on this part here we can see that all of North Smithfield and Woonsocket, there's a larger number of kids who have asthma in those areas. But when you look at this map, you can see it's really kind of concentrated in this northern tract in North Smithfield and this kind of stretch in Woonsocket here. Same thing in Providence. We can see Providence as a whole is part of the highest quintile, the highest rate of kids who have asthma. But it's most of the city is covered with that, but then the east side of Providence is blue. So we see big differences between east side of Providence and the rest of Providence. The maps are all up on here on this side too if you want to spend some time looking in them in more detail. I'm happy to email this to anyone who wants to look more. So then next we're looking at the Medicaid asthma ED visits. So this one is looking at the whole Medicaid population, so all children on Medicaid who's having an emergency department visit for asthma. So here's where we start looking more into the severity of asthma. And we can see some similar patterns starting to emerge. So in terms of statewide, again, it's Woonsocket, Central Falls, Pawtucket, North Providence, Providence, and Newport that are in the kind of highest area. So how are you? And then here's the census tract version. So again, looking a little bit more fine-tooth. We do see, let me explain on this one. For areas when we start seeing the crosshatch parts here, or the areas that are grayed out, we have a small numbers data policy at the Department of Health. Which basically is a way of ensuring that when we report data, that we're reporting valid and stable, reliable data. So when you have really small numbers, a small change of one person having an ED visit one year and then not the next year can change the rate a lot if it's a small number. And so this is a way to just ensure that we're reporting stable information. So if it's colored on the map here, it's reportable. We have a kind of in-between area where it's a little bit starting to get towards the unstable area, and so that's when we crosshatch it. So it's reportable, but just interpret with caution. It might change a little bit from year to year. But if it's a solid color, then it's a stable rate, and it hasn't changed through this. And we're looking from 2013 to 2017, so over the course of 5 years, looking at each of these census tracts. So again, we see the kind of largest cluster being in pretty much all of Providence except for the east side, a stretch of Woonsocket here, a piece of Newport, and then there's a few other areas kind of throughout the state that we see this as well. Just a spot there. Then we're going to zoom in a little bit and look closer at Providence. And so we're doing these presentations all around the state, especially in the areas that are showing up as these hotspot areas. These maps, we don't have a report published yet. We have it written up. We just finished kind of analyzing the data. We're ready to report it, and we wanted to start by bringing it to the community, sharing it with the people who are impacted by it in the communities where this is an issue. And we're willing to do these presentations anywhere. So if there's a group that you're part of, another organization, anyone you think should see this information, we're happy to share it, to email it, to come present. We definitely just want to get the information out there and get feedback from people about what should we, what does this mean? What do you think we should be doing about this? And we'll be using that. We're in the process of applying for a 5-year asthma grant from CDC, so we run on a 5-year grant cycle. And we're just wrapping up the 5th year out of our 5 years and doing these maps as part of our grant. And so we're looking towards our next 5 years and where we want to base it around community priorities and issues that arise. So here's where we zoom in to the Providence area. This map is a little bit different than the last one I showed you. I just want to explain the difference between them. So the last map we are looking at everyone in Medicaid and looking at the asthma ED visits, the emergency department visits for asthma. On these ones, we are zeroing in on kids in Medicaid with asthma and how often are they going to the emergency room. So it's a slight difference, for data nerds out there, statistics people, it's a different denominator, same numerator. So we are looking at a smaller population. We're looking at kids with asthma and looking at what's happening to those kids with asthma. How often are they going to the emergency room? And so within this, we start seeing, previously kind of like all of Providence was either orange or red. We're seeing kind of more of a clustering of where the kind of reddest, highest quintile areas. So these are the census tracts that are the highest in the state for kids on Medicaid with asthma. And you can see, in terms of statewide, it's really kind of this general area is where we're seeing the kind of largest clustering of that. And it's not just because this is where most of the kids with asthma are living. We're looking at rates here, so it's comparable to other areas. So it's not just the number, it's the rate. We know that this is a significant issue in these areas. And we'll be talking more about this in a little bit in terms of some of the patterns we're noticing in terms of the bands of where these hotspots are falling. Before we get to those patterns, I'm going to be wrapping up here soon in a little bit. Just want to touch on inpatient hospitalizations. So these are the most severe. These are kids who are not just going to the emergency room with an asthma attack, but having to spend the night or more nights being hospitalized for asthma. So at the kind of city level, municipal level, it's really this kind of cluster, the greater Providence area. And then here's the map zooming in on that. Again, this is looking at the kids with asthma, and when we zoom in here again, we see some similar patterns in terms of where those hospitalizations are falling. So we know in terms of factors that are connected to asthma, poverty and housing are major factors. The condition of someone's environment has a major effect on asthma, and so there's only, when we talk about medical management of asthma and what can the doctor do, there's some really important things for doctors to be doing in terms of medication, in terms of diagnosing asthma correctly, making sure that families understand how to manage their asthma, knowing what their triggers are. But asthma is triggered by environmental influences, and so what's inside the home and outside the home and the outdoor environment are major factors for asthma. And we know that there's differences in people's environments, especially in terms of communities that are more impoverished and areas that have substandard housing. And so these are some previous maps that we've done from older data, but we definitely saw kind of a clustering of asthma in areas that have really high rates of childhood poverty and the density of public or subsidized housing. And so we know that housing is a major factor when it comes to asthma. These are some maps that are produced from a tool that the EPA has called EJ Screen. It's an environmental justice mapping tool. And it's a way to look at a set of different environmental factors and a set of demographic factors, and you can look at them separately, and then you can combine them to do environmental justice indexes, they're called. And so you can play with this map. You can do a lot of different things with this tool. It's a really powerful tool. And so just to show what we're looking at here, this has nothing to do with asthma. This is just looking at, on the left, is the rates of low-income population compared to the rest of the state. And on the right is the percent of minority population, people of color, communities of color compared to the state. So we know that low-income communities of color are clustered in certain areas. And there's a lot of social factors, economic factors, histories of redlining and residential segregation that are related to that. And so we're comparing some of these maps to asthma and seeing how these factors relate. And so we definitely do see some match in terms of this, and we do know that asthma is very much concentrated in low-income families and in communities of color. These are maps looking at some of the environmental factors in the EJ Screen tool that we know from published studies are connected to asthma. And so this has to do with outdoor air pollution. And we'll be talking about this more in a little bit from the study that the DEM has just wrapped up. So the map on the left is the EJ Screen map of the diesel particulate matter. So these are particulates, the fine particles that are emitted from burning diesel fuel. And so this is part of the NATA, the National Air Toxics Assessment, thank you, is what that stands for. And so this is comparing each census tract that you were looking at to the rest of the state. So the areas in red are in the 95th to 100th percentile, which basically means if you were to take every census tract in the whole state and line it up from lowest to highest, these would be in the top 5% in terms of comparison to the rest of the state in terms of that data set. This one is a respiratory hazard index, which combines a few different pieces. And again, we see some similar patterns there in terms of the downtown Pawtucket Central Falls area and the Providence area. And then this is one that we've been looking at all the different maps. They all have some comparison similarity. This one visually seemed to be the closest match with when we're looking at our asthma maps that we've wrapped up for the Medicaid. So this is what I showed you earlier. This is the rate of asthma emergency department visits for kids with asthma on Medicaid. And so we haven't yet done a statistical analysis of this. This is early preliminary kind of assessment of just looking at kind of correlations and patterns. And something that we think needs some further study to really look in depth and kind of see, kind of use the power of statistics to analyze this further. But we did see, in terms of these areas of kind of the hotspot areas, that it did seem to be clustering around some of our kind of busiest trafficked areas. So the map on the left here that we're looking at is traffic proximity and volume, so just that environmental factor. The other ones I showed you were compared to the rest of the state. It's similar looking for the state, but this one is actually compared to the rest of the country. So across the entire United States, if you line up all of the census tracts in the US from lowest to highest in terms of traffic density, the areas in red would be in the top 5% of traffic density, which I didn't think, Rhode Island, we're a pretty small state, I didn't think it would compare to, somewhere like LA or New York or other areas that we know have very heavy traffic, and I was surprised to see this on here, which is why we wanted to connect what we're talking about here and have some conversations working with our partners at DEM to look a bit more in depth in terms of traffic and the impact that traffic has on air quality, and knowing that from published literature around the country and other places that there are strong links between traffic-related air pollution and health effects, particularly with asthma and children with asthma. So I'm going to pause here and turn it over to Barbara to share the results of a recent study, but are there any, we'll have a chance for discussion at the end, are there any questions, comments, things that you wanted to ask here before we kind of switch gears to talk about the highway study?
Just quickly with the traffic, is it number of cars, is it like volume of cars, or is it like idling cars?
It's the combination, so it's traffic proximity and volume. So there's a kind of data description for it in the EPA tool, but it's a combination of the daily traffic count, the number of vehicles, and the distance to the road. So in that census tract, kind of how close to a road it is. So
a residential road?
What's that?
A residential road?
Yeah, so
okay.
Residential. I'm assuming they looked at kind of residences and people,
okay.
kind of proximity to the traffic.
Thank you.
So it's kind of the person to the traffic connection.